do we have a quorum?
I have 1, 2, 3,
Thank you.
4, 5, 6, 7. I have 8.
So that is a quorum.
I believe it is. And we have 9 because I now have Melissa.
All right. So we can start this marathon of a day now. So I welcome council members that are here, as well as the members of the public. And as you know, today is the public forum day. But before we start with the public forum, we will have a business meeting with the council. So we'll start that meeting, and then we will begin the public forum, which again, for us members of the council, we look forward to it every year, and this will be our third one. So a couple things to know. As we start this agenda, Paul Frenzel will be, unfortunately, he'll be late, as well as Joe Everett.
Joe Everett just walked in.
He just walked in, he will not be late. Todd Brackett, I'll tell people that he has to leave by 2:30 for family, and Jamar is sick, and if he's gonna try to come in by Zoom, but if he can't, we wish him well and a speedy recovery. So that is the business before we start our meeting. Right, we will start with introductions. Why don't we start online? And Amber.
Hi, everyone. My name is Amber. I am an individual in long-term recovery. I am also a clinician at an MAT clinic in Northern Maine.
Melissa.
Hi, everyone. Sorry to not be with you today. I'm at a conference, so I'm just hopped into my car for this. My commitment to the council is strong. My name is Melissa Hackett. I use she, her pronouns. I'm a policy associate at the Maine Children's Alliance and the coordinator for the Maine Child Welfare Action Network.
Thank you. I think that's it for online. So Sheriff Brackett.
Good afternoon, my name is Todd Brackett, I'm the sheriff in Lincoln County.
Good afternoon, my name is Daryl Stewart and I'm the acting state budget officer.
Afternoon, Betsy Fitzgerald, representing the litigating subdivisions.
Hey everyone, I'm Tess Parks. I'm the policy director of Maine Recovery Action Project and a person in recovery.
Thank you. My name is Pat Kibble and I'm the current chair for the Maine Recovery Council.
Good afternoon, Chastity Toole, the executive director of Maine Recovery Council.
Hello, Elizabeth Fortier, coordinator for the Maine Recovery.
My name is Grayson Havens. I'm with the Attorney General's office.
Brendan O'Neill with the Attorney General's office.
Maggie McLaughlin, I'm a member representing a litigating subdivision.
Hi everyone, Joe Everett, CEO of the Opportunity Alliance.
And I am Deb Pullen, the clinical director for the Office of Behavioral Health, representing the Department of Health and Human Services in the state.
Thank you all for coming today. So our first order of business is to approve the minutes for our last meeting, and I believe you all received a copy of that, as well as there's a printed copy over near the door. Oh, quickly before we take the motion on those minutes, Holly, would you like to introduce yourself?
Yes. Hello. My name is Representative Holly Stover. I'm actually driving in your direction, so I'm going to be shutting off my camera and just listening in on my drive-in. I'm in Dresden, so I shouldn't be too long.
All right.
Thank you.
We look forward to seeing you also.
Thank you.
All right. So if you review the minutes, if you don't have any questions or concern, can I hear a motion to accept the minutes?
I'll make a motion.
Joe made the motion. Do I hear a second?
Second.
Seconded by Amber. Any discussions, deletions, additions, anything that you have for the minute? If I hear none, then I will take a roll call. Grayson.
Amber Pulsifer,
Yes.
Betsy Fitzgerald,
Yes.
Daryl Stewart,
Yes.
Deb Pullen,
Yes.
Holly Stover.
Oh, Holly's in the car. She can't vote.
Joe Everett?
Yeah.
Yes.
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 Melissa Hackett,
Yes.
Yes.
Tess Parks,
Yes.
Todd Brackett.
Yes.
Thank you.
All right, so thank you all, motion carries. Before we all start, I just want to make sure that you are aware of some updates. First of all, as you all know, we're having a special meeting on Tuesday, November 25th from 12 to 1. It is a Zoom only meeting. And that meeting will have one agenda item, and that is to discuss the grant management RFP. Then the December meeting of the Maine Recovery Council will be Thursday, December 11th from 1:30 to 4:30, but Zoom only. We were unable to get this room, so we made a determination it's December. So we're going to have that be a Zoom only meeting for December. Then for committees, the changes for the holidays, program and grants will be combining November and December meetings, and they will meet on Tuesday via Zoom on December 9th from 3 to 4:30. Governance is moved to Friday, from the Friday after Thanksgiving to Friday, December 5th from 11 to 12. And the school work committee's first meeting will be either December 5th or December 12th from 12 to 4:30 in Augusta. And we will let you know when that's been verified. Any questions about the dates? I love filling your calendar up. So I do want to clarify before we start about the nomination of officers. So according to our bylaws, the officers for the council are voted on every January or at the annual meeting, which is the first meeting of the year, which will be the January meeting. And according to our bylaws, you have to receive the names and nomination 30 days before. And our December date doesn't work quite right. So you will be receiving the people's names and nomination within 30 days in an email. That way you will have them 30 days before the vote in January. So you are to, by December 1st, you are to send the nominations to Paul and Chastity by December 1st. Then they will be reviewed by the governance committee on December 5th to develop that slate of nominee officers. Then you will be mailed those by December 8th. So you'll have them before the council meeting on December 11th. And the voting will take place on January 8th for those people who wish to serve in office. I ask you that you're more than welcome to nominate yourself. It's certainly acceptable here. But if you nominate somebody else, we're just asking that you make sure that you tell somebody that you're nominating them, and they don't have the embarrassment of saying, I don't want to do that in a public meeting. So if you could just do that before you place their name in nomination, and again, send those December 1st to Paul and to Chastity, and they will make sure that you get the information according to the bylaws. So, any questions? All right, so I think we are now at a point where I'm going to turn it over to the executive director and the coordinator for their reports.
Just one thing, so we're gonna wrap this up long before the hour, hopefully. Last meeting, the council asked me to come back to program and grants with a recommendation to reallocate the $225,000 that was gonna go to Church of Safe Injection. We did that, I don't remember the date, at the last program and grants meeting. Provided two options to them. Grayson, can you put it up? It's the last page in your packet. When we went through the two options, the committee decided to go for option one to make that the recommendation for the council. So in that option, it's $75,000, which is what we gave all the SSPs was $75,000 for 1 year. So $75,000 to Coastal Recovery Community Center and MERAP, who are the only two organizations not getting specific syringe service programming money from the council. And then taking the remaining funds and splitting it $25,000 each to give to Spurwink, Needlepoint Sanctuary, and Wabanaki Public Health and Wellness. On top of their year 2 payment. So just increasing their year 2 payment by $25,000. the reasoning for the three of those. Bangor, obviously, there's active HIV crisis that's being managed, and those are the programs dealing with that. And Spurwink is absorbing everything that Posey left. The CDC's ask of us was to just please make sure Coastal and Spurwink got something, because those were places they knew needed funds and they didn't have it to provide to them. So what we need from the council today is decide if you're gonna accept Program Grant's recommendation. And if you are, a motion to approve that, which Brendan helped me draft one, if that's the way you wanna go.
So it's option one, if you're looking at the chart, the program is a grant.
Recommended.
Recommended.
At their October 20th meeting.
Sure, I make the motion.
And the motion states,
I'm just gonna let Betsy read it.
I know that.
Heavy lifting, I'm sure.
Motion is to reallocate $225,000 of syringe service programming funding, which is the remaining funds from the now terminated SSP contract with the Church of Safe Injection as follows: $75,000 to each of Coastal Recovery Community Center and Maine Recovery Access Project for one-time, one-year funding for syringe service programming, and an additional $25,000 to each of Spurwink, Needle Point Sanctuary, and Wabanaki Public Health and Wellness to supplement their year two funding under their existing SSP contracts. Is this in the package?
I'm gonna send it to you.
Oh, so that is the
I can write
motion.
it down.
Do I hear a second?
I'll second.
Thank you.
And we have a motion second. How about, do we have some discussion or questions about this before we vote on it? Online here. I don't see any, so call a roll, please, Grayson.
Amber Pulsifer,
Yes.
Betsy Fitzgerald,
Yes.
Joe Stewart,
Yes.
Deb Poulin,
Yes.
Holly Stover,
She's still.
Joe Everett. Yes. Maggie McLaughlin,
Yes.
Melissa Hackett,
Yes.
Matt Kimball,
Yes,
S Parks,
Abstain.
Todd Brackett.
Yes.
motion carries. I thank you all very much, and I'm sure that the agencies that you just allotted the funding to will be very grateful as they continue their work. I know, and share with you, because I live in the Bangor area, I know that those two organizations will be very pleased, as unfortunately there is a need and an outbreak that we are trying desperately to work and keep people healthy. So thank you very much. All right. What other business do you have?
That was literally all we had. The only other thing that was gonna be in today is now the special meeting, so that's all we have. So if there's anything from anyone else, otherwise, I think we can start.
Just have a 2-minute break.
Yeah.
Bathroom break.
Yeah, so a couple things and we'll break before we start the public meeting. A couple things to share with the council, please. We are here till we can't stay later than 5. The building closes at 5, so at 4:45, we have to be out the building to give them 15 minutes to pack up and leave. So we do know we have to leave by then. For members of the council, please get up and move around when you need to, because you'll be sitting here for 4 hours. You please get moved. We do have some replenishment over there. There's water and some food to make sure that you don't, expire while you're here. That you have that opportunity, and I will remind members of the council. That this is a day for the public. And although you are allowed to ask them clarifying questions and to make comments, I'm asking that the council keep it brief because it really is their opportunity, the public's opportunity to share with us where they are, what they're doing, suggestions, comments, and this is their moment. So again, you're allowed to ask questions and speak, but I'm asking you as council members, keep it brief. And we are gonna do this new thing, so be very patient with Zoom and in person. So I take no credit for it because I don't do technology, but somebody else is going to help us through this, so be patient as we work through this new idea. So I'm gonna give everybody like a 5-minute break.
Can I do a clarification
Yeah.
on the schedule breakdown that you just gave? When we put out everything for the public hearing, we told people in person they needed to register by 3 p.m. So just know that part. We advertised it till 4 in the off chance there aren't any more people that have signed up at 3, like we could probably wrap. Or if we do have a lot of people and we can't get to them, we will invite them to our December meeting. That's it.
If somebody has something to say, we will listen, but again, we have to be out of the building. We'll do every effort we have to listen, and make sure everyone has that opportunity, and do that. So we're gonna have everybody like a 5-minute break. Before then, do we have to adjourn this meeting?
We should probably adjourn this, right?
Yeah.
That's right. So we will officially, I adjourn the meeting of the council and come back in 5 minutes and regroup. And start our public meeting. Thank you very much. Unless you can get a break from the car, you can step outside. to our meeting, the third annual public forum of the Maine Recovery Council. And I will share with you that, as a council, we like very much this afternoon that we're going to have, because we learn a lot. And it has often, been very helpful as decisions are being made as to how to, distribute the funds that we have. As we all know, the funds were here, given to us because too many people died, which certainly is not what we wanted. But we have this opportunity for the next 18 or some odd years to be able to distribute this money to help save lives and to, improve the lives and health and well-being of those who have been affected by the opioid crisis. Maybe when this money gets halfway spent, we will stop using the word crisis. And that would be a really good thing. So I welcome you all. I have to remind people that, again, as the council members are here, this is for the public. You are able to ask questions, but it is their day, so please keep them brief. The other thing, I remind you that this is a public meeting and we have a few things that we ask. We ask that you keep language that is non-judgmental, that is not derogatory, and it is not shaming of others. If we hear that or in any way, we will ask you to stop. If you refuse to stop, we will ask you to leave the room. That it's very important that we have a message that is clear, precise, and is not derogatory. And we ask that you keep your language again and to a civil piece, that you keep your voice, not that it's raised or yelling. And that we have a really good conversation about the message today that you would like to give us. What we're going to do is we are going to alternate between the public that is here and the public that are on the Zoom that have already signed up. So that's what we're going to do for today. Is there any questions anybody has as we start this? Before we start, Liz, would you like to introduce yourself because you came in?
Sure, I wasn't here. Yeah, I'm Liz Blackwell Moore. My pronouns are she, her, and I'm the Director of Cumberland County Public Health.
You. I asked that each speaker, only because we like to know where people are from, if you would give your name and the city that you live in, so we just know who you are. Also, if you have statements that you would like us to keep on file, please email them to our email address and we will keep them on file with us to make reference to. All right, we're gonna start with Zoom. We're gonna be very brave and patient with us. We're gonna start with Zoom. So we're gonna ask that, and please excuse me if I'm pronouncing this wrong, Mary Beth Puckett will speak first, and then second will be Patricia King. All right, thank you. So, Mary Beth Puckett, are you with us?
Yes, it just changed me to where I can present.
Thank you.
Hi, everyone. My name is Mary Beth Puckett. I am the Grants and Settlement Director for New Season Treatment Centers. We are located in Bangor and Rockland, Maine. All right. I'm presenting today on behalf of Sean Parker. He couldn't be available, so I'm more than happy to present for our clinics. But good afternoon, members of the Maine Recovery Council. Again, my name is Mary Beth Puckett. I represent our New Season Treatment Centers, where we provide medication-assisted treatment for people battling opioid addiction. In Maine, we operate 2 treatment centers and recently launched a mobile medication unit to reach more patients in rural and underserved areas across the state. Thank you for the opportunity to speak today and for your continued work to make sure Maine's opioid settlement funds are used to make a real difference in people's lives. I'm here today to encourage the council to focus funding on direct treatment services, especially methadone treatment, which continues to be the gold standard for opioid addiction care. Methadone has been studied for more than 50 years and has consistently been shown to save lives. It helps reduce overdoses, helps keep people out of the criminal justice system, lowers the spread of infectious diseases, and helps people achieve lasting recovery. At New Season, we see these results every day. Patients who once felt hopeless are now finding stability, going back to work, reuniting with their families, and rebuilding their lives. That recovery starts the moment someone is able to access care without barriers. Unfortunately, many Mainers still struggle to access treatment. Insurance limits, high deductibles, and gaps in coverage make care unaffordable for far too many people. Even though our new mobile unit helps bring treatment to more areas, many still face financial barriers. In addition to that, there's a growing concern that Maine Care is not following the new federal rule meant to protect people in recovery. Under federal law 42 USC 1396A, anyone who is diagnosed with a substance use disorder and is actively in treatment can show documentation from their provider to meet the exemption from work requirements. This rule is created so that people in recovery wouldn't lose their Medicaid coverage just because they're focusing on treatment. However, reports suggest that Maine Care is not applying this exemption consistently, which means more people in treatment are at risk of losing their coverage. Losing coverage, even temporarily, could interrupt treatment and put people's recovery and their lives at risk. That's why it's so important that Maine's opioid settlement funds be used to expand access to treatment, not just to build new infrastructure or cover administrative costs. These funds can directly help people who are underinsured or uninsured, cover medication costs, and ensure that evidence-based treatments like methadone is available statewide. The opioid crisis isn't over, and every day someone can't get care is another life in danger. By investing these funds directly into treatment services, this council can have immediate impact, helping more people start and remain in treatment and strengthening communities across the state. Thank you again for your time and for your commitment to using these funds where they will truly make a difference on the front lines of treatment and recovery. Thank you, everyone.
Thank you very much. Will you stay on, and I don't know if anyone from the council has any questions or comments. Can you ask me one more time, what was the federal law that you think that needs to be followed? What was the number of it?
42 USC 1396A.
Thank you.
You're welcome.
Any other questions? Well, thank you very much for sharing that with us today. Thank you.
Thank you for having me.
You. Patricia King. She not on?
She's on her way.
Takes a little second to.
Oh, okay, there she is.
Apologies, take a minute to load.
Okay, thank you.
Good afternoon. My name is Patty King, and I'm a neuroresource facilitator for the Brain Injury Association of America Maine chapter. I'm a lifelong Mainer from Dover Foxcroft, and in my role as a neuroresource facilitator, I work one-on-one with brain injury survivors and their support systems to navigate brain injury resources across the state. And I also work under our current ACL grant, helping establish 3 pilot sites within behavioral health agencies to become more neuroinformed. You might ask, what's neuroinformed? It's having knowledge, skills, and resources that can be applied to whatever treatment modalities a clinician already uses. As an employee and member of the Brain Injury Association Maine chapter, we recognize that there's a critical state gap in the care and treatment of survivors of overdose and substance use disorder, which is often a key factor implementing success in treatment. The need to provide brain injury informed overdose and substance use treatment. As an overdose reversal medications like naloxone become more widely available, more people are surviving overdoses. However, many survivors now face serious long-term health issues, particularly due to hypoxic or anoxic brain injuries caused by the oxygen deprivation during overdose events. It only takes merely 2 minutes of decreased respirations for effects to be made on the brain, and up to 6 minutes can cause irreversible damage to the brain. Substances like fentanyl suppress the breathing, and repeat overdoses and length of time with respiratory suppression both greatly increase the risk of hypoxic or anoxic brain injury. Why this matters? It matters because brain injury symptoms can severely impair cognitive and behavioral functions critical to recovery from substance use disorder. The frontal lobe responsible for planning, judgment, impulse control, and self-awareness is especially vulnerable to oxygen deprivation. Common impacts of brain injury include things such as impaired planning, judgment, problem solving, memory loss, difficulty concentrating, poor impulse control, slow processing speed, neurochemical changes affecting mood and behavior, fatigue, decreased motivation, mood swings, and physical symptoms such as headaches, speech problems, mobility, and balance issues. These problems can directly undermine participation and success in substance use treatment programs. However, by incorporating neuro-informed care, treatment practices, and accommodations to support those with brain injuries, outcomes can significantly improve. Identifying priority treatment settings such as residential treatment centers and opioid health homes, and expanding state capacity are key recommendations. Screenings for brain injury using the online brain injury screening and support system, commonly referred to as OBIS. Training and technical assistance for providers via telehealth and the ECHO model. Neuro-resource facilitation to help individuals access community-based brain injury services. And brain injury support groups and peer supports. Ongoing outreach, education, and system building efforts, and strengthening online brain injury resources for statewide access. These recommendations build on lessons learned from the Maine Office of Aging and Disability Service current federal funded brain injury state partnership grant pilot projects focused on co-occurring substance use disorder and brain injury that we've been having in Augusta with KBH, Lewiston with Spurwink, and Presque Isle with Aroostook Mental Health System, and access the potential for statewide implementation. Thank you for considering our input and recommendations at the forum today, and we stand ready to work with the Recovery Council to respond to this emergent epidemic affecting many overdose survivors and their potential for treatment successes. And this is also submitted by our Executive Director, Stephen Wade. Thank you.
Thank you, Patty. Question? Thank you very much. That was very informative, and I appreciate your time and effort and the work that you do. Thank you. Thank you very much.
Thank you.
Thank you. So we're going to switch to in-person. So in-person is Brent Anderson.
I didn't know there was 15 of you, so here's 4 of these. I'll give you one.
Thank
And
you.
this is also a scannable document, so I can pass them out, scan them on your phone. Thank you. It has a proof of case study in there.
Chastity has one. So
Okay.
thank you very much.
Share this. My name's Brent Henderson. I live in Portland, Maine. I know I only have 3 minutes, but really glad Patricia went before me because she brought up a vital point for a product. I'm actually with R3. I'm a community consultant and also a person in long-term recovery and a member of Maine's recovery community and a leader in Maine's recovery community. So in this building right now, does anybody work in this building from the council? Does anyone know where the naloxone is?
No, but it's probably
In my bag.
And in.
Right, I mean, just in the building in general, like, that's the issue, and that's why we're here to address it. So, this is one box. It is an opioid emergency response box, synonymous with like an AED or a first aid kit, fire extinguisher, etc. So, in here, it's any size brand of naloxone, a PPE kit, or a CPR mask. But how it kind of differs is we believe in proximity, education, emergency response, and training. So in 1 minute and 14 seconds.
First off, let's take a deep breath. Step number 1 is to check to see if somebody really is unresponsive. You can do that by gently shaking them and shouting, or you can use your knuckles against the sternum to see if you get a reaction. If you find this person is unresponsive, please call 911 immediately. The next step would be to remove the safety barrier devices for you, the rescuer. Once you're protected, remove a single dose naloxone from the 1 box. You will insert this into the nostril. As you aim the tip towards the ear, you will push the plunger firmly. If you find that this person is not breathing proficiently, you want to use the rescue breathing mask face shield that is in the 1 kit. Push the light block down into the mouth of the victim, raise up the chin, pinch the nose, and breathe. Once spontaneous breathing returns, we want to place this patient in what we call the recovery position until the paramedics arrive. And that would be on their left side with at least one hand over their head and a bent knee to keep them in place. Once the paramedics arrive, you want to give them information on everything that you have done for this patient, and you will give them any used or unused naloxone.
It says wait for EMS, and there's also a Spanish version
Primero que nada, respire profundo. El primer paso es asegurar.
for,
Primero que nada,
and then
respire
there is a
profundo.
6-minute
El primer paso es asegurar.
The first thing that you want to do if you come across someone you think has
6-minute
overdosed
scalable
with opioids
training
is
for
something like
corporate settings, HR departments, et cetera. But and you guys pass it around if you want to see the box as well. But yeah, I just wanted to thank you guys for, having the public and having the time. But essentially one box turns passive naloxone storage into a proactive training tool. So that's the goal of it. As she had stated on previously before me, we call it EMS right now. The average response time in America is typically 16 minutes, can be longer for rural communities. Unfortunately, I was a person that, I don't like to say victim of the opioid epidemic, but my family was directly affected, myself and my mother, through overprescribing medications. I was prescribed oxycodone at 15 years old, at 13 years old. And by the age of 15, I was a full-fledged heroin addict. My mother included. We used together. Most kids, ate breakfast with their families before they went to school. I had to shoot my mother up. That was the life, that I lived. Unfortunately, I lived to tell the tale here and try to make a difference in communities. When I was 19 years old, my mother suffered an overdose, and I had to throw her in a bathtub full of cold water and basically shake her back to life. Education wasn't relevant then. Narcan was a thing. It has been a thing for a long time, but education wasn't there. Distribution wasn't there. We didn't really know what to do. I'm trying to save lives here. We're trying to save lives here. And there's in that grant proposal kit, there is a implementation in the county in Wilson County, North Carolina. They've saw their overdose deaths go cut in half, emergency response cut in half, but all of that, and even besides the humanity of it, it's fiscally responsible as well. You'll find that on page 9. But we've basically expanded education through community-based distribution programs based on the principle that more everyday people are armed with this information, the more lives are going to be saved. The cost of saving a life versus a life ending is insurmountable. You'll find those figures on page 9. And we understand the most important part of, distributing opioid abatement funding is tracking. So each one of these boxes can be retrofit with a QR code from that specific county, community, city, even reservation. So it allows real-time data tracking. For instance, was the box used? Was EMS called? Does the PPE need replenished? Does the Narcan need replenished? And my personal favorite, so the end user of this product doesn't become a repeat user. Here's the resources local to your community if you're ready to get help. So it's all scalable, trackable, training, etc. But yes, any questions?
Thank you. Questions? This is really sort of very interesting. The fact that it has in it the instructions, a video, so you can, if,
Ask the question.
Yeah.
What's the cost of the kit?
That's a great question. So the person who invented this never wanted cost to be an issue. The cost of that box is $150.
is how much?
Only $150. And it lasts 7 years. So average cost between Narcan inside the box and the box itself is 25 years to the county or municipality, which is nothing in the grand scheme of things of saving lives. So there's also flex boxes, which are smaller for more rural communities that might want to have to put these outside. To my understanding, I work with the Portland Recovery Community Center, and I'm trying to get them up. Well, I am getting them on board. That's how we, distribute these things. There's communities in rural Maine that people have to put purple light bulbs on their house to signify that they have Narcan inside. Obviously that's a great part, and I love to see community actors. We're trying to take, communities dependent upon first responders and turning them into community responders themselves. But yeah, 150.
Any other questions?
You said you're trying to get PRCC to get some, anywhere in Maine have these yet? Yes, there was a distribution effort in Westbrook 2 years ago, but I am currently working on, getting the funding, pushing them through the centers, getting them out to the communities. But in there is a video on the scannable, how it has worked in Wilson County, North Carolina. They've distributed. Typically, we see a model is per 10,000 citizens, 100 boxes. That is what's worked for Wilson County. All the statistics are in there. There's a book of citations where they've been distributed on last page. But yes, $150 to save a life and have long-term scalable training.
Yes, sir. You said, there are a smaller box that's suitable for outdoor.
Yes, because that's a battery, it's a computer, a smaller box. It has the QR code, so the great thing about this box is it requires zero network like internet connectivity. But in communities that might have to put this outside, you can scan it. That video will pop up right on your phone. Because I've interviewed many people and I asked them, what have you done in the event of an overdose? And a lot of people say they Google it. And that's not what we should be doing. It takes up too much time. You're scrolling through, you're on WikiHow, how to reverse it. Like that's not what we want. But yes, there's smaller versions of the box without the screen and the battery that allow you to scan it and get it right to your phone.
Thank you.
Yes, sir.
Thank you very much for sharing that with us, the information. Thank you. Paige Nichols?
You guys want printed copies or do you want me to email? Yes.
Afternoon, council members. My name is Paige Nichols and I'm the Chief Innovation Officer at the Maine Department of Education. I live in Pownell. I want to share a little bit with you about a Tier 1 intervention model that is showing enormous success in Maine schools. The model is called BAR, which stands for Building Assets, Reducing Risks. And I know many of you are familiar with it because others have presented about it to this council in the past. In 2009, Maine was included in some early testing and studies of the model and its impact. And in 2023, using American Rescue Plan Act funds, we scaled to 71 schools in the state. We are now up to 92 schools in total across the state. The model is built on two main pillars: building strong relationships and collecting and evaluating real-time data to design immediate, individualized interventions. The Department of Education has received 2 annual reports, one for school year 23-24 and one for school year 24-25, showing positive impacts on academics, attendance, and behavior. I'd be glad to share both of the full reports with the council later on if you're interested. Some of the data points that really stand out are a 34% decrease in failure rates and a 45% decrease in behavior referrals. These percentages are averaged across all BAR schools in Maine. Additionally, 72% of BAR schools in Maine had a 90% or above attendance rate. Many teachers and administrators report that BAR is the most impactful model they've ever experienced, often highlighting its ability to impact a variety of areas such as academic performance, student attendance, and staff to student and family relationships. Notably, BAR was recognized by the Substance Abuse and Mental Health Services Administration as an evidence-based program for youth prevention and aligns with the public health framework by identifying and strengthening protective factors that contribute to well-being, identifying and addressing risk factors that interfere with well-being, and intervening on behaviors that lead to disease. Although SAMHSA's National Registry of Evidence-Based Programs and Practices was phased out in 2018, the BAR model is still included as a prevention strategy in their tools performance reporting. Furthermore, since the council recently began considering the process of distributing the 3% set aside for special education, I thought it would also be worth mentioning some of the measured impacts that are specific to special education. Since BAR is a Tier 1 intervention, which means that it is school-wide and supports all students, special education students receive the benefits of BAR the same way that general ed students do, and special education services and staff are fully integrated. During the BAR validation study, the American Institute for Research reported that special education students in BAR earned significantly more core credits than special education students in the non-BAR condition. 82% of core credits for BAR students compared to 74% of core credits for non-BAR students. BAR follows a 3-year implementation schedule, after which point schools are considered fully trained and equipped to operate the model without coaching or training from the BAR Center. With the Maine DOE's ARPA investment, by the end of this school year, 55 schools will have fully implemented the model. 30 schools have 1 more year and 7 schools have 2 more years. Additionally, we have a waiting list of schools that are seeking financial support to begin the process of implementation. Since the impacts of BAR are undeniably positive, we are seeking funding opportunities to continue supporting this resource in schools in our state. For your time and your commitment to this important work. It's a lot farther upstream than others we've heard from. Many of you are familiar, we wanted to come back and share since we have a report from last year that was very positive.
Thank you very much. Questions? I do have one question. You said you had 92 schools in total in the state. How many counties are those located in?
14.
In 14 of the counties.
Can I just ask a question about what funding do you have right now to continue these, and what funding is sort of missing? Is it mostly for funding for future to bring more in?
Yeah, so we got a late liquidation extension on the ARPA funding, which gets us through this school year. So those 55 schools will have fully implemented on the ARPA funding. And then 30 have 1 more year before they're fully implemented. And then the 7 that have 2 more years. That's of this cohort of 92. We have a number of schools that are very interested in joining BAR. We don't have funding for them. Like, the state has been able to support them through ARPA. We're working with school districts right now for them to look at their budgets, what kind of federal funding they're using, if they're like on a school improvement plan that they maybe could put toward this. But we're really getting creative with superintendents about thinking about how this might be able to be funded for them.
Thank you very much. Aline Powers? No person, thank you.
Thank you guys so much. I really appreciate you having me. I'll be pretty brief here, but I do want to, before I get started, just appropriately disclose that I work in hepatitis C. I'm here as a citizen of Maine. I'm not here on behalf of my company. These comments are my own. Due to my role, I've had the pleasure to work with a lot of offices across the state of Maine, syringe service programs, addiction medicine providers, mobile medical units. I'm sure you guys are aware, Hep C has very few symptoms and the disease is extremely contagious. Life expectancy of individuals with Hep C is reduced by 17 years. Maine has the 2nd highest hepatitis C rates of anywhere in the country. And within the first 3 years that someone has hepatitis C, they're likely to spread to 20 other individuals. Hep C is very curable, 95% and higher cure rates when patients are offered treatment. One of the biggest concerns right here is that testing is a huge issue because current technologies that are being used in Maine only provide an antibody, which does not provide, doesn't allow providers to know if a patient has an active infection and needs treatment. So I'd like the council to consider expanding hepatitis C testing in Maine. There's a new technology that allows rapid RNA to provide providers results within 45 minutes, which could allow patients to get treated and cured much faster and remove many barriers for patients. Thank you. Are there any questions?
Questions? Thank you. I know that particularly with many people with opiate disorder, that Hep C is an issue, and again, it affects multiple organs. So hopefully we can test and do that. Thank you very much.
Thank you. I really appreciate you allowing me to comment. Thank you.
Right. So currently we have no one else is online yet. And I don't think we have anyone in the audience. There.
We're going to pass these out to you guys. It's a Maine letter of
Use that
support here from Franklin County.
So we will patiently wait and see if other people.
Yeah, there's a handful of people registered for online, but they're not online yet. So Elizabeth is emailing them and
yeah. So you're welcome to stretch, take a break. Get yourself something to eat. Thank you. It's fascinating, it's, thank you. The whole video, it's like, you see those CPR things.
Yeah.
But do you ever remember, that your past, the CPR thing, it's like. Maybe French, just have this blueprint of panic.
Oh, that's a good thing enough, but.
It just does.
Okay. We, yeah, I was doing. But now, I understand a lot. You can have the sheet here.
So. So explain the you are.
We should talk about. Yeah, no. We just.
And they're talking about different, and they're all like.
Yes, they use Easter as,
So much.
Remember they were gonna get.
They love.
Primary.
This was the best.
And they would send her picture.
Oh, the only two.
But so far.
Yeah. And like they are.
Bye.
Here. Great. And they're like, it's just-
I mean, I had.
Like, well,
I like actually.
I
get this too.
No. I think with. Her wrap up knowledge, yeah, figure it out. Crazy.
Yeah.
hearing the form again. And we are gonna start with, we're going back to online. And we're gonna first listen to, hear from Joe Hartel, and second will be Janet Drew. So Joe, you're up. And not on the Zoom? All right, well then we will go to Brent Henderson, who's here in person.
He was the one who's. Oh.
Why is he here? Say again, all right.
We don't have.
So you, were you at the concert with Barbara Leonard?
Yeah.
Was that?
She was awesome. She's so good. She was so great. It was. Yeah, we, the Maine Prevention Network band. Yeah. Conference. What did you know about? Oh, did you?
Well, I was talking to Carol Kelly. So she was there and we had a meeting. Yeah, she's great.
Barbara was super helpful, I think, to people to think about it.
Yeah.
Just doing all these tools for mapping, our mapping, just thinking about how to change. So it was cool.
Great.
Thing for people.
Yeah, it's great.
Plus, I just love her.
Pretty candid. Yeah. It's great.
The legend, you know.
Yes, we don't mind.
Who else do?
Okay. All right, so our online people have seemed to have disappeared on us. Hopefully they'll come back. So we'll take people here in person, and Georgia, you're up.
She just stepped out. I think she.
Oh, just stepped out. I'm not having very good luck today. We will. She'll be back.
It's not the burger, it's on the way in. He brings us feedback, this burger, I don't know if I should be five seven. Like, that's how the like quality of the good nutrition that's going in my body. Yeah.
So
Well, like probably not eating.
But
But I mean.
that's
I go-
wild.
She met with me
last Friday, she was like. Yeah. That's wild that that's how much it was. Yeah, double cheeseburger. Actually, I think I probably got a single cheeseburger.
Well,
When I first came back, I like.
Yeah,
bought my family dinner.
It's
like $40.
Me too.
Going out.
What tonight?
That warming.
What? I like that it listed.
So.
Said what?
7 grams.
What's this mean?
Just, it's like, like, how it's a shoot.
Let's go to the garden tonight, tomorrow night.
It's got the driver's day of steak, drive on. They're like, no, they're like, and you go to the garden. Yeah, I'll be there. I mean, yes. But we, that's why we keep that like shack gym in the box. And.
I know you always think it's all the script, but now I forgot.
Except they're not. Well, we don't.
The long trip is on.
Are you ready?
Right, you can follow, is that on that?
It is not, but Alan can do that. I'm more than willing to do that.
All right.
So it's.
Good evening or good afternoon. My name is Georgia Underwood. I'm the ED of the Recovery Wellness Community Center in Sangerville, Maine, which is a project of the Maine Recovery Council in the Attorney General's office. And I'm here with Alan Burgess, who's the program manager. And what we're here today to tell you about the Recovery Wellness Community Center in Sangerville and how it is such an important part of Piscataquis County. People often describe our area as rural, but we know better. We're the frontier. I'm calling it beyond rural. Picture Northern Exposure, the TV series. That means our towns are far apart, services are limited, and for many, getting to the nearest treatment center can take hours. For someone struggling with addiction or mental health issues, that distance can mean the difference between getting help and giving up. That's why having a recovery center here at home matters so much. It gives people access to support without leaving their families, jobs, or communities behind. It is a place where people are met with compassion instead of judgment, where recovery feels possible. And when people recover, our whole communities get stronger. Families heal, businesses have dependable workers, fewer people end up in crisis or in the justice system. The center also creates local jobs. And we do that through EMDC and keeps resources right here in Piscataquis County. Frontier Maine is known for resilience and self-reliance, and the Recovery Wellness Community Center reflects those same values. It shows that even in the most remote part of the state, we take care of our own. And now, Alan? You, Jojo.
Hi, I'm Alan Burgess, like she told you, I'm the program manager of the Recovery Center. I just want to talk to you a little bit about some of the strides we've made with the community and how excited we are about them. Like, I don't think that it can be understated or overstated, maybe is a better way to say it, but what has happened is when we started this, we started talking about a recovery center, right? Here's the question that we get. What's a recovery center? I don't get it. What do you do? What happens there? And it was kind of hard to give them an answer, to be honest. Well, we have meetings, you have a place where you can come. And our first year, we've really spent trying to get the community to believe us that we're worth it, trying to buy into what we do. And they really didn't at first. We get a lot of backlash, right? We're in a very, very like rural, very kind of tight area. And they're not sure about all this stuff. But what we've seen now, I was told when I first started, if you guys do this well, what will happen is the community will start to come to you. And we've had an amazing experience with that happening now. So when someone comes to us and they say like, well, what can you do? Like, I'm in the grocery store. I'm looking for at pork chops, and the next thing I know, I'm having a conversation with someone about their nephew or their aunt or their son. Can you help this person? What do you guys do? What do you do for them? And we say something, well, have you heard of a recovery coach? A what? How does that work? What kind of insurance do I need? And we tell them, just come here. We can help you. And I had a really interesting conversation. I think this is really important with a counselor who works at Mayo in our area in Dover. And he comes by and he talks to people just because he enjoys it there. He said, the people that I talk to there, they're so much more engaged than the people I see. Why is that? He asked me, what's the reason for that? And I told him through conversation, well, the reason is because you have to have a certain level of organization to see a psychiatrist through a hospital, right? You have to have insurance. You have to have a primary care provider. You have to make an appointment. You have to then go 4 to 6 weeks later when you get that appointment. We see people in their moment of crisis. We see people who have no idea where to go. And I personally know that feeling. I'm from Guilford and I have substance use disorder. I've been there. I've sat in a parking lot before and I've Googled, how do I find recovery? And I say that now because I use the word recovery all the time, but I highly doubt at that time in my life I was using the word recovery. Probably it was something like, how do I quit doing drugs, right? Tell me. And what I would get is a business, a rehab of some kind, which I'm not speaking against by any means, but when I call it, this is what they ask. What kind of insurance do you have? Well, I have 4 cigarettes and a quarter tank of gas, right? That's what I have, and that's what most people that are really struggling have. Walk through the door, within 5 minutes, you're talking to someone. Looking for something, looking for a resource that you don't understand. What's a detox? What's a recovery coach? What kind of meetings are available where? When we're the only spot in a 50-mile radius that you can get those kind of answers, it's so, so valuable. And we have a youth program. The schools are reaching out, and here's what we're seeing. The community's going, you guys are doing really good things there. Our best advertisement by far is someone that you know finds recovery. That's taken us some time, but it's happening. When that happens, it moves the needle. We can hang flyers and we can give testimonials, and those are all great, but when you know someone around town and you've known them for a long time and the local police are seeing them be arrested often, all of a sudden they're getting better. They're gaining some weight and they're getting their kids back. That's our best testimonial, and we're seeing it all the time. We just got ourselves into the county jail so we can recovery coach in there, which has been a year-long process of banging on their door. And they let us in, and the high school is inviting us to come now, to be a part of. We know that if we hang an open sign on the door and just wait inside, no one will come because they don't understand what we are. So I just really wanna explain to you how important this center is for recovery and how it really is our only avenue. And we see it changing people's lives, and we want it to continue to forever, really, if we can. So thank you very much for letting us come today.
Thank you. Stay for just a second if people have questions. I just want to say, one of the nice things to do is well, we helped them purchase an old church. And so they rehab the whole church. It's very warm, but they have this tradition that I just love. They put it on Facebook all the time. They have the bell from the church. And so if it's your anniversary, you ring the bell for how many years that you see them pulling on the big, the chain of the thing to celebrate those years. And again, I know this community very well. We spent 5 months living with them. And to see them marching in a parade in a recovery center is just amazing, because there's a lot of judgment. Sometimes there's a lot of hidden people who need, but when you see them all with your, recovery center signs rolling down that parade route, it was very refreshing to see. But I do love your tradition of the bell. Keep putting that on Facebook. I just love it.
Okay, thank you. We love it too. It's something when you ring it 39 times. You're tired, but what an excitement it is. People love it, and the neighbors are starting to understand what it is.
And
So
it's
they-
located in a tiny community of Sangerville. It's an old mill town, and it's just a tiny mill town. So it's great. Questions or comments, Tess?
Thank you, Alan. Thank you, Georgia. I remember when you were at the first public forum, I think you were one of the first people to go, talking about the county, so it's really special. And having been there, it's such a special place. You had mentioned that when an individual wants to seek detox, inpatient treatment, there's barriers of insurance, transportation. Can you talk about any other gaps or needs that you're seeing from folks that are coming to the center? And maybe, what would you think are some ways that we could support connecting people to care?
So without a question, our biggest barrier is transportation. We're this huge geographic area with this small population. So it almost doesn't matter where we're located, we're always in the situation of transportation. I'll give you an example. Lately, what I've been hearing is Milo. Keep hearing this. So Scagwas County is big. Milo's 45-minute drive, probably 40-minute drive. Anything we can do to get people to us, and it's been a tough problem to solve, because someone who's on the fence of looking at recovery, they're kind of dipping their toes in, they don't love the idea of getting dropped off and not being able to leave. This is a little bit scary to them. Here's a few of the things we've done. Our partnership with Healthy Acadia has been amazing. We work with them so that I'm a recovery coach, and I have a coach coordinator through Healthy Acadia, so I can recovery coach there at the center, and we work together great. And if any of you are familiar with Mackenzie Kelly, we've had a blast making it happen. We had a blast working in getting into Scagwas County. So one thing we've done is we use this all recovery meeting model a lot. We've really found it beneficial. It's an easy way to welcome everybody to the table and just bring people together. So recently, I think this is our fourth one, it's actually today, and I had to miss it. Working with an options liaison in Piscataquis, who's from Milo. It was just so bad, she walks in, hey, I'm from Milo and I'm in Piscataquis now, and I'm like, perfect, we have room for you. And what we've done is started an all recovery meeting in Milo. So what we're trying to do is branch out. We're trying, I feel like if we start an all recovery meeting there and we get same model, if we get somebody who like buys in and then wants a recovery coach, which I can do, I can recovery coach them, they can start to recover, see the value. We were actually just at the Kiwanis in Milo last night talking to them. So I would say without a doubt, because then the next question is Greenville, right? Same thing. Everyone's like, Greenville, you gotta get to Greenville. It's like, how? Most of the high school stuff that we do, some of the kind of talks we've done and career day stuff, we've done in Guilford because it's right next door, and that's why. But Dexter's not in our county, but it's definitely part of our community. It's right there in our kind of circle. We'd love to be more involved there. They have a great social worker, so we're in touch with them, but we don't do a lot there. Milo High School is so far away. Greenville High School is so far away. That's our biggest challenge.
Can I ask a question, Pat? I want to echo Tess. It's so good to see you, Georgia, and good to meet you. And I'm so happy you came today. It's been a hard week, so this is a bright spot hearing from you. As a provider like yourself, there are sort of so many unmet needs in your organization, and you're growing. Can you sort of articulate what some of your needs are? From, is it staff, infrastructure, so you spoke to sort of the gaps in service, but now to care for your center, like what do you need?
Sure, as a matter of fact, Georgia and I were just talking about this on the way down. We do all our own, basically all our own maintenance, right? So I snow blow in the morning before we get there, rake our leaves, all those kind of things, anything we can do ourselves that way, but also like administrative assistance. So now we found by far, for example, our best fundraising is good programming. When we do really good programming, people show up and they donate to us way more than we do by putting our energy into fundraising, which we do some of, but it's just been a lesson we learned that we didn't necessarily know going in. So like, for example, having someone we could say, okay, we have these 5 people that we really need you to send thank you letters to, right? Or just the stuff that needs to be fun, this kind of stuff that needs to get done. It's super important. The cleaning and all that kind of stuff that we do, all of that. Which we're doing better with volunteers, but volunteers are a little tricky in our area because sometimes you might get someone for a 4-hour schedule where they don't really have that much to do. Other times you could really use 7 volunteers. So it's a little hard to kind of work that out. So that kind of staffing is crucial, and we definitely need more recovery coaches. I'm almost full. Like I said, especially with other stuff that we have to do. We're making it work. There's no question about that, but we could really use more. Most people in our county have never heard of a recovery coach. So getting people to volunteer. We had an in-person recovery coach academy at our center, which was a huge success. We're thrilled about it. What we wanted to see that we didn't necessarily see is we wanted to see an in-person ethics, where a lot of those people who took that would come back and take the ethics. That didn't happen. A little harder to recruit for because the recovery coach academy, you could get anybody to come. The ethics had to be someone who'd taken the academy. So we're really hoping to see those people come back, and they didn't necessarily. So that's a huge moving the needle forward if we have more coaches.
Thank you.
Thank you very much.
Thank you. Thank you.
Keep going. Thank you. Ring that bell. All right, so we are back to online, and it's Joe Hartwell. Hartel, hey, Joe. Here he is.
Nice to hear from you. Just wanted to say it was good to see Alan up there, and I've run that recovery bell myself, and they're doing a great job up there. Yeah. So my name is Joseph Hartel. I'm the interim director for the Together Place Peer Run Recovery Center. We're located on 2 2nd Street in Bangor, Maine. And I wanted to share some research from the 2025 Penobscot County Community Health Needs Assessment. They recently identified that mental health and substance use related injury and death as top health concerns. And it also notes that substance use, housing insecurity, and homelessness are closely linked to social issues affecting residents. In the county-wide survey, more than 60% of respondents reported that substance use negatively affects them, a loved one, or their community, and more than 70% said that opioid misuse or illicit drug use negatively impacts their community. This assessment also report an overdose rate of 62 deaths per 100,000 residents. So we're still seeing high overdose rates in Penobscot County. And here at the Together Place, where we work closely with the options team and the overdose response team, we're doing a really good job responding to those overdoses. And we want to be able to continue to do that. And we'd like to be able to expand those services. It goes on to say, in January and May of 2025, we were several percentage points higher than the state's population. And there were 167 fatal and 2,009 non-fatal overdoses, demonstrating that overdose remains a major threat despite overall statewide declines. So we're still seeing these high overdose numbers. And to be honest, we're still facing a crisis, in terms of we're seeing these high rates of folks that are unhoused. We're seeing high rates of HIV, and we are seeing still high rates of overdose. I mean, we're responding to these overdoses every day. And so grateful for the options teams and the folks over at CHS who are doing a great job. But housing instability compounds that risk. And we've just recently opened up a warming center in Bangor, and we are going to be welcoming 40 guests a night. And we want to be able to offer recovery programming and also harm reduction techniques to these folks so that we can get them into recovery services and help them find a pathway towards employment and towards stability. So we really need your help. And I just wanted to point out one thing about the unhoused population in Penobscot County. So we need to have a better plan moving forward on how we're going to address issues around the unhoused community and around substance use. And we didn't even know until just a few days ago that we were going to be able to operate this warming shelter. And so, I'd like to see better coordination with the city and state in terms of that. But let me just read on here one more minute. So beyond overdose risk and housing instability, there's a general need for just a place for people to go, right? So in the city of Bangor, we have a lot of local businesses downtown. We have the Bangor Public Library, but the unhoused community are not welcome in these spaces. And the police and organizations like Street Plus, tell them to kind of move along, and we just want to be able to provide a space for folks. And that's all I had to share. Thank you for your time.
I always love to hear your wisdom. And I know that the work of Together Place is crucial, and I know, again, it's in my neck of the woods. I know being in a neighborhood that is such a high risk, for you to be, for that Together Place to be there is essential. Thank you. Questions for Joe? Representative Stewart.
Hi, Joe.
Hi.
My question is, at a time when we're seeing overdose rates decline in most of the state, not all of the state, what are some of the other things you think that would help? I know you have this other high rates of HIV, and I would be concerned about other infectious diseases at this point, but what are things that you think sort of in a larger systemic framework are going on that could be utilized? Is there anything that's missing, I guess?
So we have some amazing outreach that's going on with teams like Options and Path. But I think we could use some more folks kind of in the downtown Bangor area doing some aggressive outreach and providing resources. I also think that there's really a gap in services in the continuum care. And when folks go to the hospital, there seems to be a drop-off point where people aren't really getting connected with those services that they need from the hospital. And so they kind of wind up falling through the cracks and kind of cycling through hospitals and services. So there's just a lack of coordination between providers in Bangor. And I think that, you know, if we could collaborate better, and maybe one way the Maine Recovery Council could do that is putting out collaborative grants, so that it kind of forces us to work together. Because in these nonprofits, we often find ourselves competing for money rather than working together to solve the issue. And I don't think that works very well.
That's not a Bangor problem.
Unfortunately, it's universal, but Joe, it's a great extension that we should do more work with collaborative grants. Yeah.
Thank you for that insight.
Of course.
Thank you, Joe. That's great. Anyone else? If not, thank you very much, Joe, for your time and good luck getting that warming center up and running.
Thank you so much, Pat. Good to see you.
You're welcome. Next on the Zoom is Doug Dunbar. Welcome, Doug.
Whoop, I'm trying to get, okay. Hi there, sorry. These are my dollar store glasses. I know some of you, and I'm in my car because each day I volunteer with this tiny nonprofit organization that sometimes I wonder why I started it a few years ago. And I'm glad I'm going after Joe because he's more eloquent. And sometimes my passion gets the best of me, and Joe is very good at sharing information. But I'm also in Bangor, and I'm in my car because each day I take people through this nonprofit called Penobscot County Cares to methadone clinics in the morning and other places. And so I'm just going to lay out a couple of things. The gentleman from Piscataquis County, who I should know, can't remember his name, he hit on transportation. It's a big issue. There are so many people in Bangor and this region who struggle to get the medicine they need to get well and stay well. It's an enormous issue. I don't know what you can do about it, but transportation is an enormous issue. I feel so guilty any day that I can't get out and drive. I take care of my 90-year-old father. He has dementia. He lives with me. I'm blessed to have this time with him. But when I can't get out and drive, I know that some of those people won't get their medicine. We don't have public transportation on the weekends. And of course, if you go outside the greater Bangor area, there's no public transportation. Some people can get rides through Penquis in our part of the state. I'll stop with that. You understand transportation, an enormous issue, and it makes it difficult for people to get their medicine and stay well. Number two, what I really came to say, I guess, is that the drop in overdose deaths statewide and nationwide is so wonderful, but it's not happening here. It's not happening in Penobscot County. We're on track to lose as many people as last year. And last year, of course, was the, second worst death rate in Penobscot County ever. So I used to be Governor John Baldacci's press secretary. And when I was in the governor's office as the press secretary, drinking too much, I'm in recovery from alcohol use disorder. I was drinking and suffering from obsessive compulsive disorder. That's why I drank. But when I was a governor's press secretary, when I was his press secretary in Congress, I would have been the first to put out that press release saying, the rates are dropping, they're dropping, how wonderful. But when I see those press releases or I see those news stories here in Bangor, in Penobscot County, I think, wait a minute, it's not happening here. And someone asked, thank you for asking, what is going on? And Joe hit on these things, so I won't take up much more time, but we have an unprecedented homelessness problem. It's not just Bangor, but it's really bad here. Unprecedented. Number two, we've criminalized homelessness, and this relates to your work. We have criminalized homelessness, not just in Bangor, not just in Maine, but really across the country. There was a recent Supreme Court decision about that, Grants Pass. You may be familiar with it. And it said, sadly, if the shelters are full, even if the shelters are full, you can still arrest people or force them off of public property. And so what's happened here in Bangor? So anyway, a lot of people in the recovery world and in the homelessness response system, statewide and locally, were aghast at the Supreme Court decision. And I said, why be upset with that when similar things happen every day here in Bangor and other communities across the state. You can't stay overnight in a park. So what's happened here, and Joe touched on it, the police and others keep forcing people out of sight. And most of the people now who are unsheltered homeless, because our homeless shelters are always full, they now are all along the railroad tracks down by the river. And they're allowed to stay there now because they're out of sight. And so many of those people suffer from a substance use disorder or co-occurring disorders. And so we have vilified these individuals. And so what do we need? We need many more case managers. We need much more supportive housing. We need better transportation. And we need much better messaging as individuals, organizations, your group. We all need to do a better job of making sure people are not vilified, not treated with disdain. And it is just so frustrating. But again, the real reason I came here, I guess, was to say rates are dropping, yes, but not everywhere. And so messaging is important. I don't want my friends in this part of the state to let their guard down and say, we're doing so much better. We're not. And of course, even though the rates have dropped statewide, these are still hundreds, and you know all this, hundreds of unnecessary, preventable deaths that have ripple effects through families and communities and workplaces and on and on and on. So I just hope our messaging, again, as a former press secretary, that we kind of get it right or get it better. And again, we need much more housing, supportive housing. And I don't know what you can do about it as a group, but you can all do something about it as individuals and in your families and in your communities. Much more housing, supportive housing, much more transportation, many more caseworkers. And we've got to change our attitudes, and we've got to speak up. We've got to speak up. This is the last thing I'll say. Sorry. There was a beautiful ceremony with people, elected officials here in Bangor, with shovels and hard hats turning over ground at the Hope House in Bangor yesterday. Lovely ceremony. Again, as a press secretary, I would have loved to have organized it. But here's the problem. Because we sometimes act with such slowness and such a lack of urgency, because we live comfortable lives, privileged lives, we don't often put ourselves in the shoes of the people we're trying to serve. Because of that, I looked at that ceremony with almost disgust, because the money for that project came to Bangor through ARPA funds, not opioid settlement funds, through ARPA funds almost 5 years ago. And so many of my friends during these last 5 or 6 years have gotten sicker or died. They could have benefited from that. Oh, and by the way, the beds that are going to be built because of that project with the nice shovels yesterday, that's only to replace beds we lost 6 years ago, almost 6 years ago through COVID. So COVID came, we lost the beds at the shelter, the Hope House, because people had to be, separated, social distancing. So we lost beds. This project will add those beds back. But by the time those beds are added back, it will be more than 7 years since those beds were initially lost. So my point about that is we need greater urgency. And we just all need to do a better job. I don't know if any of that made sense, but thanks for listening. And thanks for your work. Thanks for your work. You all get it. You're experts far more than me. Take care.
Thank you. Those were wise words. I thank you very much. Anyone here? Any comment for Doug? I think we know.
It's a good message for the council.
It is.
Urgency, our grant process, the need, the speed to which we're able to respond, like guilty. I mean, it's really hard. Everything Doug said is true. It's just really hard. And
again, it's a good reminder about the urgency of it. And again, thank you, Doug, for reminding us what we already know, that this work is important and it needs to be efficient and it needs to get out there
Yeah.
because people are dying and I hate. I'm very grateful that we are in some parts of the state being able to make improvement, but that doesn't mean the fight is over. That doesn't mean that we don't continue. Any day, one person dies is just one too many. So.
Oh my God. Yeah. I've lost so many friends. And last thing I'll say is, and I've not been happy with the state process or the opioid settlement fund process locally in Bangor or Penobscot County, just like the ARPA funding. It took years to get the process started. We act too slowly because we live privileged, comfortable lives. Take care.
Thank you, Doug. Thank you. All right. Oh, do we have Laura on? Good morning. It's afternoon. Afternoon, Laura.
Oh, time flies when you're having fun, Pat. Yes, Laura Sanborn. I'm here as board chair of Save a Life in Lincoln, Maine. And we're at a point where after December 31st, we do not have our $50,000 grant from the Office of Substance Abuse. And we have more and more folks coming through our door because of peer-to-peer in Millinocket closing. And we're only 33 minutes from that Millinocket area. So, here we are, searching and finding recovery coaches and, gearing up to serve twice the population. And good God, when December 31st comes, we have a small $15,000 grant, and I don't know what we're gonna do. We have applied, through, for your funds, but, we didn't score very well. So, we're out there, hopefully, Penobscot County with their opioid funds will be able to assist us a little bit, but, the need is so, 15 communities in northern Maine where, people are traveling one lady an hour to come to our NA meetings twice a week. We really need more resources so we can take the service to their area. And so they don't have to, spend, 3 hours of her week she spends traveling to get the service that she needs. And she lives in really rural Penobscot County where there isn't very good, she can't even do a Zoom with us. Her cell phone doesn't work where she lives. It's, a whole different, ball game up in, northern Penobscot. We're lucky we have like Scott Party in Bangor. We, have new people going into his sober houses. But, there's a need in, the Lincoln, Millinocket area for more sober housing. If we can do anything, collectively, we'd be, more than willing, but just, it feels good to get this off my chest. And, thank you all for listening.
Laura, can I ask, the contingency plan as of December, if you don't get some funding out of the opiate grants from Penobscot County, will you have to close totally, or are you gonna be able to stay open?
We would, we're having a meeting Monday afternoon, our board meeting at 3:00. Then, we're gonna, start deciding, we have the best director in the world there now. Yeah, and she's our one paid employee. And then the other is our finance person. That's the only payroll, that we have. Luckily, we, worked with some really great volunteers that have come out of, peer to peer. And, but yeah, after Monday, we probably, will have a concrete plan of where we're headed.
All right, I just want to say thank you to the people who volunteer and work and save a life, that I'm very appreciative, because we know that that area has a severe lack of services. We have a question from Todd.
Just clarification, the Office of Substance Abuse grant that you were talking about, or funds, was that 50,000 or 15,000?
50,000.
Thank you.
Yeah, and what we were told, and I haven't had it confirmed by members of our legislative delegation, that those funds are being designated for the drug court in Aroostook County, which is really needed. But how do you say, we're not going to be able to help you? You can't come here. And, in the last 3 weeks, we're doing 50 meals a day out the door. That, we've had volunteers come in and make meals, and, 50, 3 days a week, people are picking up, meals. That's how, we adapt. When I heard, about the grocery store. Last week, I was at Bell's IGA in Orono, Maine, and this lady was struggling with a whole armful of groceries, and my husband and I gave her one of our bags to put it in, and she started crying. And her brother-in-law had just overdosed at her house and died in Howland, Maine. And, we were probably 45 minutes, and those are things like right over, in 1 hour, we were able to get this lady, someone to talk to that evening. She had a daughter that, was there when all this happened, and it and I'm not going to share my Lincoln story, but it was a 4 generation with one young man committing suicide. So it's it's a needy area.
Pat, can I make a comment again? I think again for the council, Laura mentioned they didn't score high. We really need to think about technical assistance. I mean, hearing Laura, I wanna fund this.
Yes.
But the RFP process is so hard, so I'm just pinning it for maybe the grants committee, but I think you're very powerful information, Laura, thank you for sharing it. But I think it's really hard, and Todd, to what you've said over the last 3 years, just making regional money more available, easier, I think is something also we need to contemplate, because it's like they're gonna close, or they're gonna reduce the service level, so just preach to the choir, but I felt the need.
And the closest peer recovery center to you is Bangor?
Bangor, yes, yeah.
And Bangor's not Lincoln.
Bangor's not Lincoln. It's two different things, and that's a long drive. It's also the whole idea of peer recovery centers they're in your community. And that's what makes them work. And when you have to travel, people are Lincoln, and travel all the way to Bangor, it's tough. Other questions?
I have a comment that's sort of to Joe. The director they had last year came to our forum and spoke about this and told us how they spent money they didn't have to hire a grant writer to do that, and warned us that they would be in this position this year. So it's just really unfortunate, and that's just another piece to add into what we're looking at going forward.
And the urgency of our work. Questions again, Laura, thank you, and please pass the message on to the people at Save a Life, how much we appreciate all that they do for the community.
Thank you so much.
See what we can do. Thank you.
For like 30
Oh, we
seconds.
have more people?
I just want to see if they're ready.
Look, I'm so bad. Jesus, sweetest lady. We're just waiting for a few minutes to see if there's somebody that may be coming on. I don't think there's anyone in the audience that wants to. Think it was Tim. Safe travels.
Yes. It's like say, it's not less than. There's some really good people.
Yeah, I'd like to.
Anything that we do, raise them.
So we're trying to make it. They're, they can see.
All right.
Make an announcement, anyone ready to speak, feel free to raise your hand.
Okay, so if there anyone is on Zoom currently and have not signed up, but would like to speak, please raise your hand and we will change it so that you can speak.
We have somebody ready?
We're not sure they're.
Yeah, we don't train them.
They don't have their name, so.
Okay, so person who's on there that says patron who wants to speak, I'd appreciate it very much if you introduce yourself and share where you're from before you speak. And again, the reminder, I try to keep it at 3 minutes. You're welcome to speak now. Prone. Yeah. You're on mute if you didn't know that.
Oh, no.
Mike. No mic. Well, if you don't, it's you that doesn't have a mic because you are on mute. Can you speak now? Don't know.
Yeah, it's great, it's really good. It's such a struggle. But that's all of it.
Oh, well, thank you for trying. All right, well, I'm gonna take them back, that's, leave it to you, but.
Taking a break?
Okay.
I guess so.
You're gonna mute it?
Oh,
Well, we're just gonna take a short break until some people end up coming on.
All right. Sign up, and as I said, if someone doesn't sign up, by 3.
Gordon's down there.
We will do it, but I see a familiar face and he has signed up. So,
Has.
you're welcome to speak, Mr. Gordon Smith, if you'd like to come up.
To resist an opportunity, I suppose.
You would not miss an opportunity, so.
Yeah, where are you having people speak from?
It'll be right in the middle.
Oh.
Sit, feel free to stand, because you can sit.
You can sit there.
Yeah.
I really did not, but I was kind of stopping in to see how it was going, and told you that a number of people comments, and I think now that you've done this for the 3rd time, that it's less compelling for people to have to come, because they know that because of the new processes, they can come to the public comment period at any meeting.
And it's time to switch it up, I think.
Yeah, and but you have a statute that requires you to have public, an annual public meeting like this, and I think that's safe. So I don't really think. Here, I try to monitor your meetings, and you've had a busy year as you come to the end of the calendar year. There are changes in board changes in staff. I think as we relate to my work, you saw we had an important story this week that, you know, the Press Herald headline was a little stronger than used, probably, that the overdose deaths have plummeted. But we do remain about 19.5% decline from a year ago, and that's all good. And it will be hard to maintain that pace as we start comparing year to year to years that we also have a decline. So, but as long as it's going in the right direction and all, it gives us a lot of, I don't want to use the word cover, but it does give us a lot of credibility. Like when Ann Seitz and I were at the city council in Auburn recently, where they have a moratorium on syringe program. You know, I think it gives us credibility to be able to say, let us do our work. Don't hinder our progress, what we're doing in our strategic plan. I just put the office back. There's like 2 copies of our strategic plan left in the world. And, you know, let us continue to work on those 36 strategies and enhance our pillars, and don't hinder us, because it's working. Now, if overdoses were spiking, if we had, you know, if things were going the wrong way, it would be more difficult to maintain that posture. So I think you're doing great. I hope to continue to be able to monitor your work, and I hope if you ever need anything from me, you'll let us know. But I think we're very proud of what we've done. We have a great team. I just spent 2 days at the university doing some class work with speaking to some classes with Dr. Sorg. It's the first time that Dr. Sorg's been able to join me in those classes. And that, frankly, that's just a lot of fun to talk to a new generation of leaders that will be hopefully far more effective than we've been in some ways. So happy to answer any questions you've got. Happy to stop in, and glad you've had a good day, it sounds like.
I have a question. So one of the things that people seem to struggle with, and I don't know what the solution is, but it's workforce development. That I'll use the horrible example of the detox center in Bangor had to close down for 2 or 3 weeks because they had no staff. And so, and I hear other programs saying, this would be great, but I can't, you know, there doesn't seem to be, there seems to be a workforce issue. do you have any thoughts or a plan as to what we could do, either not necessarily the council, but the state, what needs to happen in order to get that, to really look at that issue of workforce and move it forward?
Well, we had a workforce summit just a month ago, led by Joy Gould in the governor's office. So we've done that for several years. So there's a lot of different initiatives. One of the things to think about is all the, you know, the solution to the workforce issue has to be multifaceted, just like all out work. We have to have more people in the pipeline and for the traditional professions that we have. We also need new categories of health professions. You know, the best examples I use are our community health workers, recovery coaches. We've got our community paramedicine project. So we need to be creative in making sure that we haven't over-credentialed the field, so that when, you know, I can get the help of a recovery coach who we have trained for 4 days, but they have lived experience, put them in every emergency department. And that will be more support, that peer support for these individuals would be could be far more effective sometimes than meeting with the addictionologist and waiting for the lead nurse. So again, I put a lot of promise into those kinds of programs. And we miss an opportunity if we don't absolutely give opportunities to people with lived experience. They want to give back. The vast majority of our recovery coaches are people with lived experience. And we should make it possible for them to be able to advance. Hire them as a recovery coach, but give them a credit to do a credentialing program to be an LADC in our community college system. And, you know, I think there's a lot of those things that will be on people's agenda. Yeah, actually the detox, I was told an hour ago, gonna have to close again for a few days. So it's heartbreaking when, you know, all of you around this table and myself have made these investments in these beds and there's nobody working them. So yes, it's a real problem. But I do think there's a couple potential solutions.
Yeah, I would just add, I think the professional staff is really hard to come by. I mean, the detox is struggling. We struggle with those level of folks. I love what you're saying, Gordon, about the people with lived experience, because there's such a wealth of knowledge about, they can describe a whole clinical process because they've lived through it. So they're hugely valuable, and it's hard to fund. I mean, the system's been so cost shifted to Maine Care that we don't have money to pay for those folks. And they're such amazing people, and they do so much work when we're able to have folks. So they've really enhanced our system. And then it does free up the whole, you know, then you can maximize, and this is kind of a paradigm shift for doctors, nurses, LCSWs, LCPCs, but they need to do here, and then other people need to do here. But our system is done, we have all those folks, myself included, who do way more than I possibly need to be doing. We rely on my colleagues that do X, Y, and Z. So I do think it's shifted over the last 4 or 5 years with COVID but it's still, we have 550 employees. We have probably 50 or 60 vacant staff positions. So it's still pretty hard. And they're really key positions. You know, we're running 24/7 programs, so we need we need folks, so. Can I make another suggestion? Just, we were talking at the break while Gordon's here and Deb. We were talking about kind of we had Sarah Squirrel, I think, visit in 2022 or 2023, and now you're here, Deb, and Gordon, you could come back. But I think having kind of a state of the department, like we have with Sarah, because it's such a static world or such a robust world, it's not static. So what you guys shared, Gordon, you and Sarah, way back then, it's different.
Yeah.
Funds available are different.
Yeah.
You're still working the strategies that you just said, Gordon. We'd love to hear more about those in a more like dedicated way, so you'd have time. And but I think it'd be hugely beneficial to the council because we were just talking about, like, we can't fill all the holes.
No.
And you and the department can't fill all the holes, so I think we need to work together to sort of address, like we just heard from Alan and Georgia, like they're gonna run out of money. So anyway, just
Yeah, I think it's absolutely essential.
I was just gonna add, and I also think by January, it sounds like the Moss Center will have a better list of all the things that the local subdivisions are doing with the funds. So I think it's like an addition to know what's happening locally so that we can then see what holes remain that really are like prioritized.
Because if you know what the state is prioritizing where they are, and they also realize they can't fund everything. And so if you know where the municipalities are investing and putting their funds, and then you look at it and we can either enhance maybe it's some programs that are there, but also fill in those gaps of the things that are essential, but for some reason can't be funded. And how does that move forward? But I think it would be nice both times, I think, to have the state come back and do sort of the state. And then also talk to the Moss Center about when they can expect to have their data and what the municipalities are doing with their funds. I think would be two very interesting parts of our meeting. I think it would be great. Do you have a question if someone knows? They put in a regulation in the LADC and the CCS ones that said that a CCS can never supervise a former client. That's still there.
I don't think so.
Think so. Because it was it's weird, you would think, well, you wouldn't want to supervise a former client, but what happens at the halfway houses is residential care. Often people graduate, they become sober and they get a degree and they whatever, and then they want to work at the residence, which is great because they have all the lived experience. But then the person who's the program director was there when they were there. So it's like you couldn't, and for a while there, and I'd actually petitioned the board and said, do you really mean, what if someone hasn't been here for 15 years? And now they wanna come back, and the question was, never means never. And it was in the CCS regulation, I have to look it up. But it was a barrier because again, many people wanna come back with lived experience, go back to the residential programs. And it's very refreshing to be able to say, I know what it's like to be here. We have volunteers that go in to the program, but.
Can I speak to that?
Yeah.
Good. As someone with lived experience and surrounded by people with lived experience, I think sometimes there's a risk of us feeling tokenized in terms of being pulled into peer support roles, and then we're underpaid and we're working in highly traumatic environments and we get burned out. And then those of us that have criminal records face even more barriers than ever becoming licensed professionals.
Correct.
So I think part of the workforce issue is recognizing that and paying us so that we're not tokenized and that we're actually valued and having career path opportunities and ways to seal criminal records or make it easier. Like I've had friends that have been in recovery 5 or 6 years, they go for their LADC, and then in order to move through that process, they have to write to every single courthouse they've ever had a charge with explanations. So I think if we want people with lived experience to stay in the field, then we need to bring down the barriers when they've proven through their actions that they've been accountable and they wanna move forward with that. That's something very common that we hear.
And we all know that licensing board is a good question. Very good point.
Well, thank you for letting me comment. The last thing I'll say is that we still have a need for a dynamic, ever-changing inventory of, I'm embarrassed, I said 7 years, I've not been able to accomplish where all the investments are. And the perfect example, and I was gonna mention this privately to Brendan, I learned by chance that there is a national nonprofit organization that has settlement money to just benefit public schools. I'd never heard of this before. And there are 6 schools in Maine that got grants. And I happened to be in touch with one of them. And I was so fascinated by this. They have $500,000 for over 3 years to work with just one elementary school, one middle school. On what I'd say is a very solid project of working with families in that school and their children impacted by substance use. And you should, not only should I know that, you should know that. And it's just a challenge that we don't have a central, now the Moss people, again, I'll immediately get this to Lindsay Smith and say, you ought to communicate with these 6 schools. I know South Portland is one, Gustica is another. I don't know their projects, but I do know that those grants were a maximum of $300,000. So a maximum of $500,000 for 3 years. So I said to the schools, the assistant superintendent filed for the grant. I said, how did you even learn about this? And they learned about it from their outside school council, from people at Drummond Woodston who did know about it.
Yeah.
And must have advised, I presume, maybe publicly. But what a wonderful thing. But it would be nice for us to know, particularly where the governor made a big commitment. Liz will remember, 2 years ago to focus on 7th graders and had the prevention network reach out to 3 7th graders. But after the 1-year grants were gone, the projects for the most part were gone and they didn't continue. Well, that doesn't work. So again, it's a challenge. Governor and I only got 13 and a half months left of this work. And so a lot of our work, honestly, next year will be trying to make sure that as many of us, our projects can continue regardless of what the political structure looks like after 2026. And that will be a challenge, but it's an important objective in 2026 to not have this be an 8-year one-off and then we're gone. Thank you.
I commend you and the governor's work in regards to the attention that you were able to pay for substance use disorders. And being able, again, Gordon, the peer recovery centers I just love. But when you started your administration, there was 2. There was very few recovery homes. There was a few here scattered here and there. I know Bangor had none. And so the support and being able to move forward with, peer centers and recovery homes and all of that is just, you want to hope whoever's in office keeps that moving. But I do admire that the fact that it was a priority. It wasn't just shoved in a corner, given a title amongst, it was there front and center. Which is, again, I was on a call, one of the national calls, and somebody had said, oh, well, we don't know how to get peers involved. And I said, I think we do not that everything can't use improvement, but I'll tell you in Maine, we do a fairly good job at listening to peers and hearing the voices of people who've lived experience. We have a long way to go, but we're certainly, because they said, we can't get people to volunteer to be part of this. And I said, that's not the issue in Maine. If we ask for people with lived experience to be part of us, it's most likely we'll be able to get that. And again, that took time to do. A few years ago, that wouldn't have happened. It does now, and it's a movement. You know, we really, for me, I want to see keep moving forward. Yeah.
Okay, thank you for your work.
Well, thank you.
Gordon.
Thank you, Gordon. So unless there is somebody on the Zoom, unless there is somebody here, I am gonna call the adjournment. Oh, oh.
Oh, wow.
Catherine? Hmm? Catherine Robinson.
Can you hear me? Can you see
Hear
me?
you, Catherine. Yeah,
Now we can.
thank you.
Hi.
Oh,
Hi.
Catherine Wider. I'm looking, see, I'm too old, Catherine, that's my problem. Hello, Catherine, how are you?
Good, how are you?
I am well.
My apologies. I came into the meeting late because I had a competing meeting, but I just got to hear Gordon's wonderful words. So I do have a couple of ideas that I would love to share with you if you have time, and I will try to be really okay. The first is a project that Gordon knows well, and it is called the Black Poster Project. This is a national effort to raise awareness about addiction and overdose death, and to do some preventative work. And there's a significant focus on youth. So it is actually a silent memorial project. There are currently 853 posters of individuals who have died from overdose deaths. We brought it to Maine this past April. We stood it up in Lewiston at the Vineyard Pathway Church, where all of those posters were on display, and they're fairly substantial size. We had 19 Maine posters that were included in that event, and that number has increased substantially since they came and people became aware of the project. We are bringing it back in September of 2026. We're working with the providers now, and we will need about $16,000 in funding to do that. The base of the project is in New Jersey, and all they charge us for is the costs of getting things here. So they rent a big truck to bring all of the posters up. And of course, there are accommodations for while they are here. We had attendance of about 300 folks that passed through last year. We're hoping to increase that. We announced it statewide and hoped we would draw from across the state. And indeed, we did. We did have a snow day that day, and so we think it reduced the foot traffic that we might have seen otherwise. So that is one project that I wanted to put out there. Gordon had myself and the chief of the Kennebunk PD come on to co-present before the event, and we've received a lot of nice feedback from that. This coming year, we're going to have an open day for the general public on the Saturday. I believe it's 17, 18, 19, but don't quote me. I don't have my calendar open. But the day before that, we're going to have a closed open presentation for students. And we're hoping to bust them in with counselors, social workers, and we'll have our own options staff and other staff available to support, debrief, et cetera. It's an incredibly moving presentation. And if you Google Black Poster Project, you will find it and you can see it. So I'll stop there for that project unless you have a question and move on to the second thing I'd like to share with you. Oh, and by the way, I should have introduced myself beyond my name. I currently serve as the Senior Director of Strategic Initiatives for Spurwink, and that is who I am speaking on behalf of today. So no questions about Black Poster Project? Then I will move on to contingency management, and I'm sure some of you know of what I am talking about, but Spurwink has been offering this services through the Living Room Crisis Receiving Center for, I believe, over a year now. And we have had tremendous results, quite surprising results, actually. And I think most of you know that this is a population of individuals for whom treatment rates have not been especially good. And we recently had a president's leadership forum with folks that support our programs, and our staff provided some data. And I'm only going to take a minute because I don't want to run you over your time here today. But the results were really quite astonishing. And I was sitting in the room and I think my jaw hit the floor. So we had a total number of eligible sessions of 2,362. And the attendance rate for that was 83%. So people are coming and engaging. And of the UDs that were, urine screens that were produced, of the number is 1,950. There was a 92% negative rate. So these are phenomenal results. Maine Health Access Foundation has been funding that program, but we are going to need continued funding to keep that program moving forward. And with results like these, I think we can say that we have a winner here. The question that one of the folks who attended the President's Leadership Forum asked, and for which there is still some time needed to provide an answer to that, is, will this stick over time? And so, 3 months out, 6 months out, 9 months out, and so on. And we're very hopeful about that, but I think that is research still to be collected and presented.
Questions for Catherine on contingency management and how it worked?
Yes, Catherine,
Yes.
this is Paul. How are you?
Oh, hi, Paul. Good. How are you?
Do you know what the total amount that one person would get if they had all negative urine drug screens throughout the course of their?
Yeah, funny you should ask that. I was just speaking with somebody about that the other day. I believe it's in the exact figure is around $599. So we top it off at $600 for the full program for one person.
So $600 to get approximately 80 to 90% of the people stopping their substance use, at least for that time being.
That's my understanding. Now, mind you, I am not in the clinical program, so I am, and I kind of rolled in here on two wheels, so please forgive me, but I have folks popping me emails right now. Woo! Thank God for team, right? And so, yes, that data is correct, Paul, and we are just delighted, I guess would be a good word, because nobody really expected the outcomes to be that extraordinary.
Thank you. Maggie?
Just a note, this is something that we're very interested in as well, and actually we'll be talking about this evening at the City of Portland's opioid settlement funds conversation. But part of the existing, you know this better than I do, the long-term evidence, while it's still waiting to come out from the Spurwink specific data sets, the other data sets nationally have shown that pretty high long-term adherence to abstinence, which is really incredible when you look at the turnaround value.
It is.
Other questions for Catherine? Well, Catherine, thank you very much for these suggestions. Like, the council will certainly look at it, and thank you for the many hats you have worn and how you've always been so passionate for services and substance abuse, and always advocating for those who sometimes can't advocate for themselves. So it doesn't go unnoticed.
Thank you. You're very kind. And thank you for letting me jump in so late in the program. I appreciate it.
Not a problem, but we will keep those in mind as we move forward. And thank you.
Thank you.
Right. Welcome, Paul.
Did I miss anything?
There was singing and there was dancing. No, actually, we were just discussing, we didn't have a huge turnout. I think it's time probably to switch it up. And the council has time to figure out, what this will look like. Again, we have to follow statute, whatever statute says, but we can certainly look at, what went well here and what didn't. And so we're gonna end early because we don't have anyone in the audience that wants to speak, and we have no one online. So we're probably gonna end unless somebody has something burning that they need to say. If not, we are going to close this meeting. For anyone who's still online and listening, thank you for spending an afternoon with us. And again, you all know our email. If you have some idea that you want to share with us or things that you think we should know, we're always willing to listen. And we also have public comment for the first 15 minutes of every one of our monthly meetings. So thank you very much, and we will adjourn this. Thank you.